in the whole area of both treatment and prevention, we have an enormous gap between what is evidence-based and what is popular. This has always been the case for years, that people who like something will push it, so that in this country we've always had a great liking for residential treatment services, and they're pushed. They're still fairly popular, although the evidence base to support them isn't particularly good. And we have some, as other countries have, prevention programs that just simply don't make any sense, that there's no evidence they work, but people like them. I'm thinking about recovered addicts going into schools and talking to school children, members of the Garda drug squad going off with the suitcases of drugs to the ICA in Glenamaddy or something like that. These are all very nice things, but whether they're evidence-based and cost-effective is another matter. I'm going to talk about one episode in Irish life. I'm talking about alcoholism. I'm presenting this as a case study of an initiative that for a time period at least had all the appearances of solving my problem, that this was rational, it was evidence-based and so on. From the 1950s onwards, but I suppose particularly after Ireland joined the United Nations in the late 50s, we were exposed to what is known as the disease concept of alcoholism, which was allegedly, it used to be known as the new scientific approach to drink-related problems, and it was promoted very strongly, very explicitly by the World Health Organization. Now, essentially what this concept argued was that there was a specific disease called alcoholism, and that this disease was caused by individual deficits or defects, vulnerabilities of a minority of drinkers, and most importantly, that alcoholism was not caused by alcohol, that you couldn't blame alcohol on this, that this was just the sad sort of kind of vulnerability or predisposition of a small number of drinkers. One of the statistics tossed about commonly was only 10% of drinkers will be alcoholic. The other 90% of it, thank God, are grand. It was suggested that the prevalence of this disease in any population was fixed. It was going to remain the same. It was always going to be around 10%. And so it was unimportant whether population drinking habits changed. It didn't matter if people began to drink more. Because if you're an alcoholic, you're a goner anyway. And if you're not, why not get stuck in and enjoy it? And you do so because you owe it to those poor devils who shouldn't drink at all to have a good few yourself. That was proposed quite seriously. There were statistical formulae that could sort of work out what the proportion would be and so on. Also, part of the alcoholism notion was that there was no scientific justification for any public policy measures that would try to reduce alcohol consumption or stabilize consumption in any given population. So there was no justification for control measures that would try to restrict consumption by using things like pricing measures or limits on access and availability, or restrictions on the way in which alcohol as a product is promoted and advertised and so on. And finally, the main implication of the alcoholism concept was that it was sufficient for health policy just to educate the public about this disease. It was suggested that this was a very stigmatized disease, and people used to talk about hidden alcoholics who were so embarrassed and ashamed they wouldn't come forward. The health authorities just need to educate the public, tell them alcoholism is a disease, destigmatize the condition, and then at the same time create an expansion of treatment facilities, mainly within our mental health services, within the psychiatric system. I've never seen any real evidence that excessive drinking has been stigmatized in Ireland. And if anything, I think we had a great tolerance and respect for people who drank quite a lot. So this incorporation of this kind of American disease thing into Ireland was dubious. If we look at how this happened in Ireland, the disease concept was slow to come to Ireland. Sometimes I think that in Ireland we're slow to take on an idea, and we take it on just as the people who created it are about to drop it. And in a way, that's what happened. We were slow to come to the concept in Ireland. The 1966, the report of the Commission of Inquiry on Mental Illness gave the sort of official imprimatur to the disease concept. It's almost 100 years of self-government since 1922, and we've only had 3 big mental health policy documents. One was this, the first one was the 1966 Commission of Inquiry on Mental Illness. The second one I'll refer to is 1984, the Psychiatric Services Planning for the Future. The third is 2006, called A Vision for Change. So the 66 document said simply, alcoholism is a disease, it's recognized as such by World Health Organization, and it talked about treating alcoholism within the mental health services. And generally it uncritically reported and cited the orthodoxy that was coming to us from WHO and from the United States. If we look, and I've done this in the past, I've looked in detail, tried to see who were the main driving forces, what were the main driving forces behind promoting the disease concept in Ireland. And it was the private psychiatric system, a very small sector in some ways, 2 large hospitals in Dublin, St John of God, St Patrick's, and a few smaller ones around the country did emerge subsequently. But a crucial thing that happened was that we had the establishment in 1957 of the voluntary health insurance, a semi-state, the first health insurance, private health insurance system created. And VHI had a monopoly for almost 40 years before EU regulations stopped that. And then we had an expansion of many other insurance companies entered the private health insurance market. But VHI was started in 1957. It provided funding for middle-class people who would insure themselves, and those people, if they had alcohol problems, could go and be treated in private hospitals. The private hospitals were far more comfortable and luxurious than the public hospitals, and a lot of people who would never have gone near a public psychiatric institution were quite happy to go to the relative luxury of those places. So the private psychiatric sector identified alcoholism treatment as a sort of niche, and they pushed it. And so it was private psychiatrists who mainly promoted the disease concept, and in 1966 their influence was very clear on that Commission of Inquiry into Mental Illness report. Alcoholics Anonymous had been in Ireland since 1946. It did play a role in a general cultural sense of promoting ideas about alcoholism, but Alcoholics Anonymous by its traditions is enjoined not to get involved in lobbying or not to get involved with any kind of outside activity. So it didn't in any formal sense lobby for the disease concept. 2 AA members were on the original Council on Alcoholism that was established in 1966. And that Council on Alcoholism, INCA, the Irish National Council on Alcoholism, had the support of the Department of Health, but it was a voluntary body. And it was largely, as I say, dominated by the private psychiatric sector. So AA played a minor role and a very temporary role in that. Understandably, the drinks industry was very happy with the disease concept because what it said was their product was fine. And Inca, during its first year, struggled financially, and for the first year it took funding and was happy to get it from Guinness.